Well, thank you very much. I'd like to pay a particular debt of gratitude to Dr. Ravichandran for asking me. We're both nephrologists, and I come from a nephrology background, and particularly to the IIT Institute and all the others who've made this possible. Last night I love South Indian food, and I've spent a lot of time in Sri Lanka, and I asked the chef for a South Indian meal with far less salt in, which he did, and it was absolutely fantastic. You have amazing range of spices, herbs, and ways of cooking food, and you don't need to put salt in. If you go to northern China, they add nothing to the food. They have plain rice, plain bits of vegetable, and all they add is salt. And they don't like all the spices and herbs. So you're very lucky in India to have fantastic range of foods, and all you need to do is cut the salt out, and I'm going to tell you why. When there's a big study that's going on looking at what's called the global burden of disease. That is looking at what are the major factors that kill us, and looking at the total mortality. They're also looking at premature mortality. That's before the age of 70, because if you die before 70, you're likely to be actively contributing to society, and particularly at younger ages where you're responsible, particularly men or women, for looking after a family. And then they're also looking at the burden of disease. That is the impact of when you're ill. What does that do? And what has become clear from this big study of thousands of people participating, with Bill Gates funding it and others, is that unhealthy food is the biggest cause of death, the biggest cause of disability, and the biggest cause of premature death in the world. Now we're going to look at one aspect, and that is salt. And I'm going to look at it because of what's shown here, because the global burden of disease shows that all of the things you can measure, raised blood pressure, notice I say raised blood pressure, not high blood pressure, is the biggest cause of death in the world. Look here, it's actually killing 10.7 million people a year. Far bigger than tobacco, than alcohol, and various other things you can see there. And that's something we've got to think about. The biggest cause of death is your blood pressure. Do you all know, how many people in this room know what their blood pressure is? Can you put your hand up if you know what your blood pressure is? Why do most of you not know what your blood pressure is, and yet it's going to kill you? What I'd suggest is you go and get it measured in the next week, because you don't know what your blood pressure is until you've measured it. And I'll show you why it kills you. If we look at the risk of blood pressure, and this is a very important point, that you will see the risk, if you may be familiar, this is systolic blood pressure on the x-axis, and 140 millimeters of mercury is where high blood pressure starts, right? But if you look, I don't know if this has a pointer on or not. Yes, it does. If you look, the risk goes way down to a systolic of 115, right? So, and this is the size of these boxes is the number of deaths attributable to blood pressure. And you'll see the size of the box is greater down here than it is here. And this is because although the risk is much greater in these people with high blood pressure, i.e. above 140, the number exposed at a lower risk is much greater. Oh, sorry. I don't know if this would... Sorry. Sorry about that. You'll see that the numbers exposed are much greater, therefore the actual numbers of deaths are the same. So clearly we need two strategies. We can go out and seek people with high blood pressure and treat them, and that's very beneficial. But we need to adopt population policies to lower the population's blood pressure, because we'll then reduce the risk right down. And if you don't think you're at risk, look at the bottom there. 83% of adults in the UK have a blood pressure that puts them at increased risk of a stroke or heart attack. So don't just think it's those people with high blood pressure who are at risk. It's most of us in this room. And the reason you die, why do you die from a slightly raised blood pressure in your arm? Have you thought about that? And the reason is, of course, that if the blood pressure is raised, particularly in the brain, a vessel may burst. And you see here what's happened. This is a cross-section. The patient obviously died, and you'll see there's a big hemorrhage in the brain. And this is where a small vessel has burst because of the raised blood pressure. It breaks open, blood comes out, pushes the brain across. You see how the brain is pushed across because it's in a closed box in the skull, pushes the brain stem down, and that kills you because all those vital things of breathing, how you move your arms and all that are all in the brain stem, and that's what kills you. Now this is a relatively rare cause of death now because we're controlling people's blood pressure. But what are called lacuna strokes, small damage to vessels going up the brain stem, where a very small damage causes a big effect, because that's where all the nerves are coming down and up from the brain in this little area, and very small amounts of damage cause paralysis of one side, a classic sort of stroke that you get where you're paralyzed on one side, depending which side, whether you can speak or not as well. And of course, the direct pressure effects of blood pressure also stress the heart, because if the heart's having to pump harder against a higher pressure, and it's already damaged by coronary artery disease, ischemia of the heart, then you go into heart failure, a very big common cause of death. And of course, the direct pressure also causes kidney disease itself, and also accelerates any form of kidney disease. So that is one major cause of death. But by far the biggest cause of death that blood pressure causes is atheroma. All of us are developing cholesterol deposits in our arteries. Hopefully not many of you have arteries looking like this. This is the carotid artery, the vessel that goes up in here. You can feel it. If you ever felt your carotid, you'll feel it in here. Splits into two. One supplies the face, the other supplies a major part of the brain. And you can see here, this guy has got, I can't see this. Yeah, has it, you have to have very small fingers for this. Sorry about it. You can see up at the top is an atheromatous plaque. That's cholesterol that's accumulated in the vessel wall with a fibrous plaque on top of it. Now that doesn't do any damage. You have to narrow the artery by 70% to cause any damage, all right? But what does happen is the fibrous cap becomes unstable, and you can see an ulcerated plaque there where the top has sheared off, leaving the reactive elements in the plaque, and platelets and red cells come in and form a clot. And you can see where it says ulcerated plaque, there's a clot being formed, a healing process. But of course, blood is going by here 70 times a minute, and knocks off bits of this clot up into the brain, the heart, or the kidney, and that causes dementia, or it causes heart muscle problems, so you go into heart failure, or it causes kidney disease, because little emboli, little bits go into the kidney and damage it, right? But the thing that kills you is the fissured plaque. When the plaque splits open, red cells and platelets go in, form a clot, come out into the clot, in a big clot, and block the artery. That's what happens in a heart attack. And you know that Indians are particularly predisposed to this form of atheroma and develop heart attacks prematurely and also strokes. But this is what kills you. Now in this patient, it's a clot going up into the brain. It's blocked the major supply to the brain, has a massive stroke, and he died from the stroke. Now, blood pressure accelerates the rate of the deposition of atheroma. You need a certain level of fat in the diet, and of course you all eat vast amounts of fat in India, from coconut oil, palm oil, animal fat, and ghee and all that. And you all are developing atheroma, and blood pressure makes it develop more quickly. So does smoking. But the thing that destabilizes the plaque, that makes this ulcerate or fissure, is your blood pressure and cigarette smoking. And the reason that blood pressure does it, if you think, if that's a carotid artery, you've got this bad plaque like you've got here, and it's going like this, then there's no stress on the plaque. But if you've got high blood pressure going like this every time, it's not surprising that it destabilizes the plaque, and it kills you. So as soon as you lower the blood pressure, you stabilize the plaque, and you're much less likely to do that. Do you understand that? That is the biggest cause of death in the world through heart attacks and also strokes. Now, obviously, when we think about this, what we want to do is get a reduction in population blood pressure, better control of raised blood. Those are the two strategies for the biggest cause of death in India. Right? And this is what you should be doing. All of you should be fighting for this, because the government won't fight for it. Who's responsible? It's you and me, and particularly doctors should be fighting for this, to try and reduce the burden of the commonest cause of death in India. Now, what puts up blood pressure? Well, we've got a lot of evidence about this from all studies from all over the world. The primary thing, as we already heard from Dr. Ravichandran, is salt. Potassium has the opposite effect, particularly eating more fruit and vegetables that are high in potassium. Obesity, lack of exercise, and alcohol in excess all have effects, but by far the biggest factor is salt intake, and also the easiest one to tackle is salt intake. And I just want to quickly review the evidence. Salt, of course, is unknown to mammals. We don't eat salt. We live away from the sea. No mammal naturally eats salt. They may get to like it after they've eaten it, but they don't eat it normally. And during evolution, we had no access to salt except for people living by the sea. And we were only eating less than 100 milligrams or 0.1 of a gram of salt a day during evolution. We're now eating 9 to 15 grams. And obviously the reason it was that the Chinese and Egyptians discovered that if you soaked meat or fish in a brine or salt solution and dried it, it kept it during the winter or during, so you could preserve food, which was vital for settled communities. To live together, you need to have food preservation, particularly in times of war, famine, and so on. So it was vital to the development of civilization. But it was, although it was seen of great benefit and was of great religious importance in most religions because it was such an amazing substance, it was one of the most dangerous things that humans could do because it's killing many of us completely unnecessarily. And of course, when you add it to food that's going bad, you imagine before refrigeration, most of the meat and fish, when you ate it, was going bad. You add a lot of salt, it cleans it up and becomes edible. And that's a principle used by the food industry now. When they make some very cheap, tasteless food, you can add salt to it, it cleans it up, makes it edible. And that's why they add huge amounts of salt to McDonald's hamburgers or sausages or all this rubbish that everyone now eats in the Western world. And if you're not eating it now, you will be eating it in a few years' time. And of course, we have no need for it now. We have refrigeration and deep freezers, and we also have much better chemicals. The food industry now no longer uses salt as a preservative, except the only thing we can think of in the UK is smoked salmon, which is still preserved with salt. There's no other products. You will have some in India, some of the dried fish, those type of things that are added to rice, they're preserved with salt. There's no need to have that. You can put other preservatives in, but that requires a cultural change to do, but it's easy to do. What is the evidence about salt collecting to blood pressure? And in fact, we're fortunate that the nephrologists in the late 19th century are the first to relate, French nephrologists, to salt to blood pressure. So we have very long period of study where lots of studies have been done, unlike other diets. If you look at fruit and vegetables, saturated fat, sugar, all those sort of things, the evidence is much more weak. And we have huge studies, epidemiological studies, intervention studies in different communities, all the genetic mechanisms involved of putting up blood pressure, both in animals and humans, all relate to salt. All animals that have high blood pressure have to be given a high salt intake, and if we give salt to chimpanzees, in the amount that you and I eat, their blood pressure goes up. And There are a lot of treatment trials putting people on lower salt diets in very well-controlled trials showing blood pressure falls. Then we have all the mortality studies, cohort studies, outcomes trials, all showing that salt's important. And now we have population studies, probably the best evidence, that where a whole country has reduced salt intake, there's been a fall in population blood pressure and a fall in stroke and heart attack rates. And I'll show you the studies we've done from the UK in a moment. These people are interesting because this is a Yanomamo Indian who lives in the Venezuelan jungle and still leads an evolutionary lifestyle, although they're being killed by Brazilian loggers and by infectious disease, so very few of them left. But they still eat the diet that you would have eaten in India over the last million years. Right? And that was a diet that was very low in salt. They had no access to salt, lots of roots, fruit and vegetables, and very little meat, but what they could catch. And they're very fit. They live in a very hot climate. They're eating no sodium at all. Their salt, a very careful study is done looking at 24-hour urinary sodium, which measures salt intake. It was less than 100 milligrams a day of salt that they were actually eating. Very low sodium diet. Yes, very hot. They could run 20, 30 miles pursuing animals. Under great stress, spent all their time pinching each other wives from different tribes. And you can see the average blood pressure in a man who weighs 75 kilos is 96/61. The average cholesterol is 3.1. Now the average blood pressure in India, if it's the same as the UK, is about 130/80. That's what you call normal. It's of course not normal. And the average cholesterol in England, I know, is 5.6. I don't know what is India, probably higher. And actually it should be 3. They have no rise in blood pressure with age and no vascular disease. Obviously they die of other illnesses. We're not saying they live forever, because they can't, because they die of infectious diseases and they get killed as well by Brazilian loggers. Shot. They just shoot them to take over their land. So they're a good example. What about chimpanzees? Here's chimpanzees. The blue lines are ones given their normal salt intake. They don't eat salt normally. And those are the yellow are where they're given 10 to 15 grams of salt, the same amount of salt as you eat. And look, after a year or a year and a half, blood pressure's gone right up. They're our nearest, closest genetic relative, chimpanzees. So, and the blood pressure in them on their normal diet, you can see, is only 110/60. And in fact, in the ones living in the wild where they've measured it, it's about 90/60. It's the same blood pressure as a gorilla, right? Gorillas just eat bamboo shoots. Must be pretty boring, but they have a blood pressure that's a lot lower than you and me. This is the intervention study in 2 Portuguese villages. Portugal has the highest salt intake in Europe, highest stroke rate, etc. One village had the same blood pressure measurements and talks about various things, but nothing about salt. The other village was instructed how to reduce salt, given Portuguese processed products with much less salt in. They reduced salt by 50% in the yellow village, and you can see that there was a big difference in blood pressure after 1 year and 2 years in those 2 villages, clearly showing if you reduce salt in a community, you get a fall in blood pressure. These are the studies of salt reduction, controlled studies, randomized trials in humans, one group who've reduced salt, the other who don't, in a very well-controlled studies. And you can see the fall in blood pressure that occurs and the fall in salt intake. And if we put these together, we can work out the fall in blood pressure in the population, and it causes about a 1/4 reduction in strokes and a 1/5 reduction in heart disease. And that, coming out worldwide, that's around 2.5 million deaths a year. And you can work out in India with, I think, roughly just under 1.4 billion people, the numbers of deaths that we save. It's a huge number of deaths just due to eating too much salt. Now, recently, my colleague, Dr. Salim Yusuf, who you'll recognize the name, comes from India, who works in Canada, published a study, the Pure study in the Lancet, looking at estimated, and remember it's estimated salt intake against cardiovascular hazard or mortality. And you can see that as you get a lower salt intake, it looks as though the mortality goes up. And when you're higher, it goes up, and there's a sort of a nadir at around 12 grams. And this study got a lot of publicity and may have got some publicity in India. But there are major problems with this study. First of all, he used spot urines to measure 24-hour urinary sodium, and that is an incredibly unreliable measurement. And even one 24-hour urine, which accurately reflects what you ate the day before, because all the salt comes out in the urine, doesn't indicate your salt intake. Like my salt intake today will be very high because I'm in India. When I get back to England, it will be very low, and you can, depending on what you eat, your salt intake's going like this. So it's been shown in very careful studies you need multiple collections of 24-hour urine to document what your salt intake is. You can't just measure one urine and say that's your salt intake, and that is also following them up over a period of time. So what happens to your salt intake over the next 10, 20 years? It doesn't necessarily what you were eating when you started the study. Then the other problem is that these people already have vascular disease. They already had heart attacks. They already had type 2 diabetes. They had strokes. And of course, there'll be a certain number of people in that population who are dying. And when you die, you don't eat. Now, it isn't the fact that you're not eating is causing your death, it's the fact that you're dying causes you not to eat. So the low salt intake is due to the fact you're ill, not the other way around. And that is reverse causality, which is incredibly difficult to correct. You can't correct it. Now, if we look at a study, and this is the problem, right? The measurement's useless, and there's reverse causality. So the study can be ignored, but when we look at studies that are properly done with multiple 24-hour urines in a population who did not have vascular disease, i.e. who are relatively well, who are followed up, and this is the result. You see the line in the middle, this is from the TOPE studies in the control group, that you'll see the line in the middle shows a direct straight line relationship between salt intake measured on multiple occasions with 24-hour urines against the mortality or hazard ratio. So the lower the salt intake, the lower the mortality. And there are now, in fact, 3 studies showing the same thing. When you have multiple 24-hour urine measurements of salt intake in a population that hasn't already got severe heart disease and cardiovascular disease, there's a straight line relationship. The higher the salt intake, the greater the mortality. So in other words, I'm afraid you can ignore your Indian colleague's study from Canada. It's not a good study, badly done, and can be ignored, in spite of the fact he's going around the world trying to convince everyone that he's the right person. In Japan, they had a government campaign to reduce salt intake in the 1960s. It's poorly documented, but they reduced salt intake by 4 grams in the north of Japan. You may know that in northern Japan, they eat more salt than the south, like in China. And there was a big reduction in blood pressure and a big reduction in stroke mortality. And this was when everything else was going the wrong way in Japan. They were smoking more, eating more fat, eating less fruit and vegetables. So everything you look at was going the wrong way, and yet they were reducing salt, blood pressure came down, big reduction in strokes. So pretty convincing that. And here's the results from Finland. Had a big study in Finland, in the North Korea, which had the biggest rates of heart attacks in the world. They're reducing salt, and look at the fall in salt, in a very big fall in salt, and taking it out of processed food, finished food products, big fall in blood pressure, big fall in stroke mortality. And I'll show you the results for the UK in a moment. Other damaging effects, salt also causes cancer of the stomach through H. pylori, and the mechanism's being worked out now. So major cause of death in some countries. I don't know about in India, but in northern China, major cause of death, cancer of the stomach. it causes heart failure, kidney disease. It also causes bone delamination, and that is an increasing worry as we get older, particularly in females. They're getting osteoporosis, terrible pain from collapse of their vertebrae as they get older, and salt sucks out the calcium from your body. It's the biggest. If you increase salt intake, you increase calcium excretion, and you suck out calcium from the body. So another major reason, particularly for women, to cut back on their salt intake. So there's overwhelming evidence the amount of salt we eat is very damaging to us, and we need to reduce it. And the big question is not whether we should reduce it, it's how do we do it? That's how are we going to get a population to reduce salt intake? And obviously we need to measure it and see what it is and where the sources of salt in any nation's diet. And of course, you think about India, it's very complicated because you've got a huge population, very variable salt intake from one part of the country to another, and then very varied sources of salt between rural and urban, between different religions, between people who are better off, people who are poorer. So it's complicated, and I'll come back to that in a minute. India's not going to be easy, but you have to realize you're way behind other countries in tackling this issue. And of course, in any country, some of the food is added by the consumer, and some of the food comes from food that's already had salt added, particularly processed food. But obviously when you eat out, any form of eating out, someone else is determining how much salt is in your food. So you've got to think, what are we going to do? Where are the main sources? And whatever it is, you need a 60% reduction, roughly, in India, in salt that you're adding to food, or salt that is already in the food. And depending on which country you're in, depend exactly what the plan is. Obviously, and depending on who you are and whether most of your food is coming from salt in the supermarket or when you eat out, or are you adding it at home. And obviously in India it's a mixture of food where salt's been added, and you've got to think of other things. Like we're discussing pickles, is that a major source of salt in India? And that's added to your food. Obviously in China, soy sauce is a major source. So you have to work out, and you have to have some evidence of what exactly is going on. And we need that for India. We have done some studies in Delhi with the Public Health Institute there, looking at exactly this to try and get a more strategic plan as to how to reduce salt in thing. And for the public health campaign, it's quite clear. The message we want to get across is clear. Salt is added to food is a chronic poison that slowly puts up your blood pressure and a major cause of death and disability, particularly strokes. That's what we want, all of you. That's the message. You go back to your family. Salt is a chronic, slow poison that's going to kill you in the end from strokes. And I can tell you, having worked on a stroke unit, it's not a funny way. If you survive a stroke, half paralyzed, it's not a funny way to survive. It's just terrible because you're totally dependent on other people to look after you, and incredibly expensive for the family and the state to look after patients with major strokes. And of course, we've got to use less salt. We've got to get to schools, children who can feed back to their parents, communities, continuous media activity to get this message across. And it's difficult to do and requires great perseverance. That's the problem. You've got to go on and on and on, because it's the same as tobacco. Trying to persuade people to change what they do is very difficult, but it can be done. And we're doing it in China quite successfully. Obviously, salt added by the industry is much easier, because all you've got to do is persuade the food industry to slowly take it out. And that, surprisingly, is much easier to do than persuading you and me to use less salt. And we need labelling and public education, and we need, of course, you can avoid processed foods. You could also tax salt, and that is coming in slowly, but it's not very fashionable at the moment. I could talk more about that. But the most effective thing is to get the food industry to slowly reduce the amount of salt in the food without you and me being involved. And this is what we've done in the UK. Who's responsible? Well, the food industry says, look, you've got a choice. You don't have to buy our food. You can go and cook your own food, or buy food without salt, although you can't find it. And that's their excuse. Of course, they're responsible. They put the salt in. They're killing us. They need to take it out. And the only excuse that we're going to give them is that they can take it out slowly. Because if you take it out straight away, people will notice, they reject the food and won't eat it. And this was the strategy we came up for the UK. We knew that salt intake is much lower than in India, it's 9.5 grams a day. We wanted to get it down at that time to 6 grams. Remember, the WHO target is 5 grams. And this, you have to look at, what do we want to achieve? We need to work out in India what it is you want to do, because that determines your plan. Now, we want to get it down to 6, so that meant a 40% reduction in food, salt that's added by the consumer, and a 40% reduction in the food industry. And if the food industry in certain groups of food couldn't do it, you have to make more salt, take 60% of the salt out of something else to make up for it. And that gives you an overall plan. So how are we going to do it? Well, this is a brilliant public health policy, because what we did was to persuade the food industry to slowly take the salt out across all their products. We don't have low salt products, we're just removing salt from everything, right? So we set targets for each food group they have to achieve, then we reset the target again, reset it. So we're slowly screwing the amount of salt down that they add to food. And this is brilliant because it doesn't cost anything. The food industry bears the cost. The government has to organise some agency to oversee it, make sure there's a level playing field. There's no need to change the diet, which of course may sound counterintuitive, but it's very difficult to change people's diet long term. And they go on eating the same food, and they don't even know their salt intake has fallen. So if you went and talked to people in the UK, they've had a reduction in salt intake, and they don't even know that their salt intake has been reduced. That is brilliant. And of course you get a fall in blood pressure because they're eating less salt. So you get a big reduction in strokes and heart attacks. So we've set these targets, as I said. It's a voluntary policy, so you can continuous media activity to get the industry to keep on doing it. And these are the targets here for bread, just showing how we gradually screw it down. You can see the target falling there, organised by the Food Standards Agency and ourselves. And this is a reduction in salt that occurred in bread from surveys we've done. It's come down by about 30%. Most products have come down by more than that, 30 to 40%, without the consumer realising, because it's been done slowly. Now, what about labelling? Well, that's important. Now, these are the signpost labelling we developed in the UK, and these are you get the sugar, fat, and calories actually as well. Sugar, fat, saturated fat, and salt, and then you can see it either red, yellow, or green, depending on the level. These are the actual levels. I don't want to go into the exact details of this, but you can see how most food products in the UK are now front of pack, have the label for salt and other things, either red, which is high, medium is yellow, or green. So a very good guide to the consumer. Oh, that's full of salt. That's all right. And this shows you a traffic light label, very comprehensive. It's got the concentration per 100 grams, the concentration per serving, and then the recommended intake for the day. So you can work out how much that product is contributing to your daily salt intake. Very clear. Now, these are the results of the UK when we analysed them for up to 2011. We started the salt reduction in 2005, so it's over 6 years. You'll see the fall in salt intake that occurred over that time, the fall in population blood pressure, and the fall in strokes and heart attacks. Now, not all of this fall was due to the reduction in salt. There was a reduction in cigarette smoking, slight increase in fruit and vegetable consumption, slight decrease in saturated fat. But most of the things that affect blood pressure, like weight, were going the wrong way. and we corrected for those factors as well. And we can work out that about 18,000 strokes and heart attacks were prevented a year, 9,000 of which are fatal, just by this simple maneuver of reducing salt by a small amount by taking it out of the food supply. And it saved £1.5 billion in healthcare saving costs, according to the National Institute of Clinical Excellence, at an expenditure of only about £1 million a year. You imagine that. You spend £1 million on something and you save 1.5 billion. And the WHO has labelled salt reduction as the most cost-effective of its NCD targets, and that's why salt and cigarette smoking are the two primary targets for non-communicable diseases in their plan to reduce the commonest causes of death and disability in the world. This is our action groups across the world. We set up an action group in order to stimulate people like Dr. Ravichandran and others to set up their own salt reduction plans. And obviously we can't organise salt reduction in India or in China. We need colleagues, like-minded colleagues, who are going to set up their own plans, and we try and help them by telling them what's going on in different parts of the world and so on, and that's been very successful. What is going on worldwide? Well, you can see here most countries now are doing something about salt. We worked out recently that 60 countries have salt targets like we have in the UK, copied and modified it. 30 of those are voluntary and 30 are regulated, actually by law. So the government has said the food industry's got to get down to this level of salt in different products. So it gives a level playing field to the food industry. They all want to achieve the same level, because if one does it and the other doesn't, then there may be competition between them. But in India, very little is going on, and certainly now in Malaysia, we're helping them with salt reduction, and Japan, Korea, and China are all starting to draw up plans to reduce salt in a comprehensive way. So India needs to do the same. Here we are. Here are the countries with voluntary salt targets and those with regulated salt targets. And South Africa was one of the first to regulate the salt targets, because the government Minister of Health was able to do that without passing legislation. And the food industry actually wanted to be regulated. When they asked them, they prefer to be regulated because they know that all the others have got to do the same thing. Whereas if a voluntary system, a company can refuse to do it, and then they have higher salt products than the other company, and is there an advantage or disadvantage to that? Well, what about India? Well, India is incredibly complicated, as I said. It's not an easy country because it's very diverse and a very different diets in different places. But you need to work out how much salt you're eating, where is the salt predominantly coming from, and then sit down and spend 2 or 3 days working out a strategic plan as to how you're going to get it down. Probably we guess salt intake is probably around 12 to 14 grams a day, i.e. much higher than the UK, depending on where you are, and how you're going to get it down to the 5 gram level. Now, it's not going to do it overnight, and it's got to be a mixture of salt added by the consumer, salt added at home in the cooking, salt added in other things like pickles, spices, and so on. And then the food industry. And remember, the food industry, if it's not important now in some people's diet, it's going to become more important because they're selling all of these cheap processed products, and you've got to control that. Otherwise, you're going to have a pandemic of high blood pressure, high cholesterol, obesity, and type 2 diabetes. So you've got to act now in India to prevent this happening, because mortality is going to increase as the global food industry moves in. They're killing you now, they're going to kill even more of you, and some of you who are young at the back have got to fight this and do something about it. Thank you very much.